folks. Thanks for coming on with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing a topic we're fielding a lot of questions on regularly, but particularly now in light of the situation we find ourselves in with COVID-19 and a lot of folks being laid off from work and no longer being able to maintain private coverage through the marketplace, through the Affordable Care Act and a lot of the programs that were available there. Many of the folks that are or have been Medicare eligible and have not been accessing programs through the Medicare program are finding themselves in a situation where they need our advice and our help to help determine what may be their best course of action moving forward. In light of a lot of the uncertainty that is out there concerning what will happen next in our world, having the information available for our prospects and clients is paramount to our success and for covering the needs of the folks that are inquiring about our services and what we can do for them. A bit of housekeeping to start. Today's presentation is being recorded, and that recording link and the presentation itself, along with much of the material that we will reference through the course of today's presentation, will be sent to all who have responded to today's webinar outreach. So watch for that. You will also see that the software system has a place for you to put in questions as we go along. I would ask you to take advantage of that because many times the questions are answered throughout the course of the presentation, but if not, we will make certain that we either answer them directly today or should research be necessary in order to cover those questions completely and correctly, that will be done and sent with a follow-up as well. So that said, a bit of information to start with about our organization. Premier Marketing is a national marketing organization founded in 1968, part of the Integrity Marketing platform with offices across the country. We act as an insurance wholesaler working with independent insurance agents such as yourself, offering contracts for different insurance programs at the highest possible commission level with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently celebrated a milestone in our history, our 50th anniversary, which is quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type, and for that we thank you as the agents who work with us and through us. We do so through a full portfolio of products that help address the needs of today's topic, Medicare programs such as Medicare Advantage, Medicare Supplement plans, Part D prescription drug programs, and additional coverages that many find necessary when they find themselves in this situation, including a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income programs, and ancillary benefits such as dental, vision, and hearing programs, critical illness, cancer plans, and hospital indemnity programs. Those Medicare Advantage programs include all the national carriers and many of the strong regional carriers that will make a difference for you in your market, with that same philosophy carrying over into the standalone prescription drug programs where those PDP carriers are available to you through our organization. That Medicare Supplement portfolio includes a variety of programs, a very robust menu of choices for you, including specialized support programs that help you be successful in this area as well. When you look at the different ancillary categories, all the national leaders are there for you in this area as well, and they perform a unique function for us, particularly for folks who may be coming off of a marketplace program that has dental as an option where that may no longer be an option for them under their current circumstances, and other programs that help cover gaps in basic medical coverage. When we look at the Medicare market overall, we're looking at a program that has its own language. So should you choose to have it, or if you have a need for an acronym translator, we have those for you, and we'll send those to you upon request. It's a large document. Otherwise, I would send it with a regular follow-up. We'll see what the size of some of the attachments are for this particular program presentation and see what we can do. When you look at the aging of the population, everyone speaks to the silver tsunami, the aging of the baby boomers, 10,000 people a month, one every 10 seconds. But the Medicare market is not dictated just by age. Some of those folks, as we're discovering in light of today's presentation, work past the age of 65 and don't access their benefits immediately upon Medicare eligibility. So it's a little lower than that number, 10 to 12%. But 1/6 of the Medicare population is actually Medicare disabled. And so the age demographic is not a true indicator of the size of the market in the Medicare world. And it's a diverse market where you have some challenges with health conditions and the wallet as well, income and savings. So having a diverse portfolio of products to help address those needs is paramount to our success and for the coverage that is necessary in order to take care of the population we serve, which right now is being challenged. Many of the folks that we deal with on a regular basis, particularly those of you who are active in the under 65 market, are feeling incredible pressures when it comes to not only the job situation, but the coverage that in many circumstances come with employment. So being aware of the options that an individual will have in order to cover that situation is a necessity, to say the least, because they have choices when they come into the Medicare world, and are knowing those options and offering them in a credible, understandable manner to the folks that are under a lot of pressure can make a big difference, because the decision to make a decision is a decision. Some of these folks may feel they may be called back to work here shortly and are going to decide to do nothing, and others are going to move forward with the coverage they have based on Medicare eligibility, as long as they know how to pursue those coverages. So helping them with understanding how they enroll in Part B, because if they're in a Affordable Care Act plan, they don't have it, and making certain that they have drug coverage, and then options to cover the medical expenses, be they through a standardized, modernized Medigap, Medicare Supplement policy, or going into the Medicare Advantage Part C world, is sometimes just a question of education and what would be best for all concerned. Because the folks, when they come in, and you'll note that this doesn't deal with just agents and includes the late to Medicare seniors, they're making almost an even choice between some of the base programs that are out there. Some of these folks may not need additional coverage if they receive assistance through perhaps Veterans Administration or a retirement package that was given to them. We're seeing a ton of American Airlines pilots and stewardesses accepting those type of packages. And so we see in many parts of the world that this component here, original Medicare only, may not be just original Medicare only. So we need to be aware of what's going on in our particular markets as well, because this is an opportunity to not only address a part of the market that has a true sense of urgency and a true need for things as quickly as possible, but also a opportunity to really show our worth and give them the information they need, because generally they have just standardized election periods to follow and different special election periods. Since we are seeing many of the folks come off of a group program, not true marketplace plan unless it's SHOP, they may have other ways of accessing care through these different special election periods, and we need to make certain that they have the underlying coverages they need to qualify for these as well. So as we go through looking at options that people have through their current coverage with Marketplace, which may no longer be an option, we need to be brought up to speed as much as possible, as quickly as possible, through the different training programs that are available for us. We, of course, hope to be a resource to you in much of that situation, but CMS's national training program can give you a ton of information on these situations and scenarios, and a big portion of our presentation today is taken from the national training program. So you may recognize it, and as we go through the presentation itself, keep in mind it's as if we were presenting to someone who's actually in the situation. And it gives us a chance to not only educate ourselves, but go through a bit of a role play, in a manner of speaking, and give us an opportunity to see how we can address the questions that people will have and how we can educate people as to the situation they are in more thoroughly and how they can address it. Part of the challenges you're going to have is, much as where we are socially distanced, and many of us are working remotely, not from our standard office situations. We're seeing that as well in Social Security's physical plants throughout the country, if you want to speak to that. But this gives you an idea of the fact that much of this information, when you go through for Part B, is handled by this agency, and knowing how to access the information about these locations can be helpful for us to help expedite process as much as possible. So that 1-800-772-1213 is a very important number, as is online access, with finding out which offices are closed and how we can access information online. Being the resource for this information is invaluable to our prospects and clients. One of the things we see very often that comes up on a regular basis is the folks that are working past age 65, and many of this applies to the current situation within Marketplace, even though this respectively pulls the question from a full-time employee and coming off of group coverage. In this situation, it's a question of accessing Part B, which is a big question we need to be able to answer for these individuals. And we see in this circumstance the credible answer that comes and is available on CMS and Medicare.gov's website. If they're working full-time and they stop working, how long do they have to enroll in Part B, whether to continue on the employer's coverage or lose it? This is a good question even for folks that may not be losing their Affordable Care Act coverages, to see if perhaps utilizing their Medicare eligibility is a better choice for them. You have a different sense of urgency for most of these people now, but the answer to the question is, of course, that they have 8 months from the day they no longer actively work to enroll in Medicare Part B on the best terms. They can always enroll later, but if they don't enroll during the 8-month period, they could be subject to a penalty, or would be subject to a penalty of 10% of the standard Part B premium for every full 12-month period they didn't enroll when they were first eligible. And that penalty continues until they no longer have Medicare, which means they withdraw from the program, or they are, as we used to say in the special needs plan world, they are celestially discharged. So what you have is a situation where they've got to do things properly within the time constraints that are set upon all of us when we become eligible for the situation. So this is the material that I referenced earlier from the national training a program from Medicare. It is available in English and Spanish. There are some of us that should have learned to speak Spanish many years ago and have failed to do so, but there are many folks out there that are bilingual and are in need of this information in their mother tongue. Right now, the information in this piece of it is English and Spanish. And it gives us an idea of what people with a marketplace plan needs to know when they're becoming eligible for Medicare. This not only educates them, but as we go through this presentation, it educates us. We speak to Medicare eligibility and enrollment processes and the decisions that come as part of that, how Medicare and Marketplace, we need to look at the different considerations and the strengths and weaknesses of each, and how Medicare and the eligibility for advanced premium tax credits make a big difference when it comes to marketplace consideration, how those periodic data matching programs work, and always where are helpful resources we can use besides this presentation. When we look at Medicare eligibility enrollment, of course, the automatic enrollment for Part A and Part B. Automatic enrollment is designated for those that are receiving Social Security benefits and Railroad Retirement Board benefits. So if they're not filed and receiving those benefits now, it's not automatic. The initial enrollment package is mailed 3 months before they turn 65 for the 25th month of disability benefits. It includes the Medicare card. If you're not automatically enrolled into these systems, you need to enroll as a beneficiary through Social Security. Hence the information earlier about the closed offices. But doing a lot of this online is very helpful and actually a little easier on the nerves and the whole system because you're doing it electronically, and much as what we are becoming accustomed to, particularly during this point in time of doing electronic enrollments in the insurance world, well, if the application's not complete or inaccurate, you can't submit it. Utilizing those same terms within socialsecurity.gov enables those folks enrolling in these programs to know that their application is complete and they don't have to deal with that ever-present challenge that many of us present carriers and other pieces of our lives of our unreadable handwriting. They can, of course, call that 800-772-1213 number. You can mind the folks that are answering those calls are also working remotely, so they may be dealing with differing technology that slows down the process, and then, of course, everything else that comes with that as well. They have an opportunity to do some things for the folks that are hearing impaired, and the visit to the local office, of course, at this time is not an option. You have contact information also available for those who have retired from the railroad and are looking to enroll through the Railroad Retirement Board. The initial enrollment period lasts 7 months. It begins 3 months prior to the 65th birthday, includes the month they turn 65 and 3 months afterwards. Coverage start date would be delayed if they enroll during the last 4 months, the later 2 options of this system. And of course, as mentioned before, they may have a lifetime penalty if they don't enroll during IEP. Since these individuals that we're speaking of are coming off of an ACA program, that would cover that lifetime. They would take care of that lifetime penalty. They won't be subject to it because they have that coverage. Their medication coverage needs to be deemed creditable. Most of the ACA programs would satisfy that requirement, but they need to be prepared to provide proof of that so they don't also subject themselves to a challenge with their drug coverage. How people become eligible for Medicare are questions that sometimes agents even active in this space don't really know how to address, so this is helpful. So if an individual or their spouse paid enough Medicare taxes, they can qualify for Part A and don't have to pay a premium. If the individual and the spouse didn't pay enough Medicare taxes, they may have to pay a premium for Part A, a hospitalization as well. the vast majority of people that we deal with are not subject to an additional premium. It's 10 years worth of payment into the system, which enables them to have a premium-free Part A. You will see people with a premium for Part A that may be graduated in the amount dependent upon how long they've paid into the system. Folks can enroll in Part B the first time in the premium Part A during that IEP. They can enroll in the premium Part A anytime after IEP begins. They'd have to defer it otherwise. And they can only enroll in Part B and premium Part A during IEP and other limited times in other circumstances. The coverage starts based on when the individual enrolls. For those folks who didn't sign up for Part B during their initial enrollment period, then they have certain time periods, a general enrollment period that they must utilize in most circumstances to begin those coverages. It's January 1st through March 31st annually, and the coverage begins then on July 1st. You'll notice we're past that time period. These folks may be subject to a lifetime penalty, 10% for twice the number of years you didn't have Part A, and 10% for each full 12 months eligible but not enrolled in Part B as long as they have Part B. So timing is everything. For these folks coming out of the marketplace plans, they have those coverages, so they may be not subject to those penalties if they do things correctly. Most of the folks don't qualify for a special enrollment period. We're seeing some different things come back and forth on this now from the government. You're seeing some of the carriers out there in the ACA world creating their own eligibility periods, and it gives them an opportunity to do some things on that side of the board that folks in the actively engaged in the under 65 market probably understand better than most. They must have employer group plan coverage based on active employment and active and current employment for the individual or the spouse, and they can then enroll anytime covered by the EGHP or within 8 months of the loss of coverage or current employment, whatever happens first. EGHP, loss of the health plan. No Medicare SEP is currently available due to marketplace coverage. We are seeing people in other circumstances have a SEP being rolled out for those that are being affected by COVID-19. So keep in mind that there are things that we can do to help these people because of the special circumstances that we're currently enduring. Keep in mind, retiring coverage is not considered active retire or active employment. So we will see in many circumstances, particularly the folks that option in or continue coverage through COBRA, have some challenges because they feel that that covers them adequately. In many circumstances it does. However, it doesn't exempt them from the time periods that we've already discussed. So when we look at Medicare enrollment decisions, does a person need to sign up for Part A? Consider it's free for most people. You can pay a little bit if your work history isn't sufficient, and that penalty might be there if you delay. And if the individual and their spouse is actively working and covered by the employer plan, many times it happens automatically. It does affect contributions to health savings accounts, and private insurance doesn't have to pay primarily if you aren't enrolled. So there are certain things that come into play that can be helpful with this for group coverage, particularly. If you have a marketplace plan and you sign up for Medicare, you lose any tax credits and the reduced co-payments and co-insurances they may be getting. So that's a huge consideration, particularly when these programs first rolled out longer ago now than we care to admit, where that was a very viable decision for folks first coming into play, and particularly now, depending upon an income parameter given to us by for those tax credits, it can make a huge decision as to whether or not they stay one way or the other. To get Part B, you got to be prepared to but have Part B if you want to purchase a Medigap coverage. Can't have a Medicare supplement without Part A and Part B. You got to have that same underlying requirement for Medicare Advantage, and TRICARE for Life requires it as well. You got to have Part A and Part B to stay active in TRICARE for Life VA. And in many circumstances, the employer coverage requires it if you are in one of those small groups with less than 20 employees. Keep in mind that the VA benefits are separate from Medicare and does not keep an individual who has VA benefits, regular VA, not TRICARE for Life or CHAMP VA, from having the penalty if they don't sign up in the original initial enrollment period. So you may be running across individuals who are coming off of a marketplace plan because of a relationship one way or another with an employer, or because of spousal obligations or whatever it may happen to be, and now are picking up Medicare coverages. You gotta watch out for that bloody penalty. When we look then for Part B and active employment, just because you don't have coverage from active employment, delaying Part B may mean higher premiums, that 10% surcharge, paying for health care out of pocket. Many folks don't realize the different parts of Medicare and what they cover, and may force individuals to wait for the next general enrollment period to enroll. Keep in mind, that was 2 weeks ago. And even if they are enrolling in through the general enrollment period, that coverage doesn't start till July 1st. That's why you'll see spikes in business in July in many circumstances, because of folks picking up the Part B. If you do have coverage through active employment, you might want to delay Part B. You can do so, and because of that active employment, it may defer that penalty if you have the coverage, or you make certain that you cover yourself within 8 months of losing the coverage. So when we look at Medicare and Marketplace considerations, some of the things we need to be very mindful of for the Marketplace enrollees is that MEC, that coverage is the minimum essential coverage that is necessary in the plan in order to help with the Part A coverage with Medicare. And look at when they became eligible for Medicare and how we can help work them through the situation. Because as the Marketplace coverage terminates, we need to make certain we're mindful of those timetables that are given to us as requirements with the different programs. We also need to watch out for the individuals who have disabilities, because it can be a additional need for, how do we say this, making certain that they have time, not that people that are healthy with coverage coming off aren't concerned about timetables. People with disabilities have a heightened awareness of the urgency of that situation. We also need to make certain that we're aware of some of the options that are available through SHOP, the Small Business Health Options Program, or smaller groups, and how that might be affected now. Keep in mind, this may be a big part of today's world that has additional economic constraints placed on them. So people with SHOP coverage may find out that that is not long for the world either. And there are means we can help people with to pay Medicare costs with limited income, for those folks with limited income and resources. We do webinars on that quite frequently on the extra help programs, the low income subsidy for medications, and the Medicare savings programs to help with medical costs under the Medicare program as well. Keep in mind, Medicare isn't part of the Marketplace at all. Medicare Part A is considered minimum essential coverage. And if you have Medicare, you don't need to do anything related to Marketplace unless circumstances demand it, much as what we're seeing in today's situation. Marketplace doesn't offer Medigap policies or prescription drug programs. Separate type of coverages, as many of you are aware, if you're active in the under 65 market. No one can sell a Marketplace plan, a Marketplace plan, if you only have Part A or Part B. And except for an employer through SHOP, If you're an active worker or dependent of an active worker, the size of the employer helps determine who pays first. No late enrollment penalty if you enroll anytime you have SHOP coverage or within 8 months of losing that coverage, and it doesn't include COBRA. There are different pieces of legislation in front of the government helping us, hopefully, to deal with the COBRA challenges that we see, but right now, we've got to work through it. If you have a marketplace plan first and then get the Medicare coverage, like the situation we are addressing today, you can lose eligibility for those premium tax credits and any reduced cost sharing for the marketplace plan. If you choose to drop the marketplace plan or vice versa, you got to pay attention to that timing. If the ending coverage for everyone is on the application, the termination can take effect as soon as 14 days from the day you cancel or is canceled. And if ending coverage for some people on the application, in most cases, coverage ends right away. So that accelerates that timetable. So if we're choosing marketplace coverage and have chosen marketplace coverage instead of Medicare, and you're paying a Part B premium, you can drop the Part A and Part B coverage and have the marketplace plan. Kind of not going to happen now in the situation we're dealing with folks that may not have the help for marketplace much longer. If you only have Part B and have to pay a premium for A, you can drop Part B and get a marketplace plan as well. If you're eligible for Medicare but haven't enrolled in it because you don't have to pay a premium, because you'd have to pay a premium for Part A, you have a medical condition that qualifies you for Medicare, like ESRD, or haven't applied for that Medicare coverage, or if you're not collecting Social Security, retirement, or disability benefits before you're eligible for Medicare. Keep in mind that's the piece that needs to be in play to have the premiums for Part D come out of that check. Otherwise, you have to pay that premium for that Part B quarterly, or if you're in that 24-month disability waiting period. Because even if you're accepted on the Medicare program as a disabled individual, unless it's certain health circumstances, you got 24 months before the Part B kicks in. If you're enrolled in premium Part A, meaning you only pay for the Part A and Part B or Part B only, you can disenroll from Medicare with that marketplace plan and qualify for tax credits. And this is a situation where you're advising individuals to still have access to that marketplace. It may be a less expensive option for them in the situation they're looking at. If you're enrolled in Medicare Premium Part A, you got to withdraw the application for Social Security benefits, pay back all the Social Security and Medicare benefits received, and lose the tax credits and the cost sharing reductions. So that's a big piece when you're looking at folks that may have part of the coverage and are looking to maintain marketplace, because that's a chunk of money sometimes. Terminating marketplace for Medicare. If you're enrolled in a marketplace plan first and become eligible for Medicare, you can choose to remain enrolled in your marketplace plan. There are important considerations. No longer qualify for those tax credits or cost reductions once Part A starts, and Medicare doesn't coordinate benefits with the marketplace. So if you choose to terminate your marketplace plan, you got to pay that close attention to disenrollment timeframes. So when we list, here's a scenario. So we've got a dude named Bernie, where you're not just spending weekends with Bernie. He's a live individual who's got some eligibility for premium Part A with Medicare. He turned 65 in June. He's got a marketplace plan now, and his initial enrollment period's begun. If he enrolls in the last month of his IEP, what's going to happen? Well, Ernie signs up in September, the last month of his IEP. His premium-free Medicare Part A coverage would begin retroactive to the first of the month he turned 65, and Bernie would no longer be eligible for those tax credits the first day of the first full month immediately after his IEP ends, so on October 1st. Looking at Sally and her eligibility for those tax credits, she qualifies for premium-free Medicare Part A and turned 65 on May 5th. She has a marketplace plan with tax credits. Her IEP's begun. She doesn't want to enroll in Medicare. She wants to keep her marketplace coverage. Sally doesn't have to sign up for Medicare for purposes of the tax credit. Sally would be considered for Medicare benefits on September 1st, first day of her first full month under her initial enrollment period ends, and she'd lose those tax credits starting September 1st. She'd need to return to the marketplace and any tax credits she receives. She'd now be paying full premium for her marketplace plan. So big difference as to the cost between the two programs. She may be responsible for paying back tax credits she's received once she's considered eligible for Medicare. Getting that bill from the government's a lovely thing as well from the government for the plan. She may face late enrollment penalties if and when she chooses to enroll into Medicare after her IEP ends. Looking at Hannah, she qualifies for Premium Part A. She turned 65 on July 19th. She's got a marketplace plan with tax credits. Her initial IEP has begun. She enrolled in Medicare in October, last month of her IEP. What's going to happen? Well, she enrolled last of the eligibility period of her IEP. She got Medicare coverage to start 3 months after she signed up on January 1st. Her eligibility for those tax credits would end January 1st when she starts receiving Part A benefits. So some of the key points we need to keep in mind, and be able to discuss: encourage the consumers to consider all options when deciding to enroll or not to enroll in Medicare Part A. Consumers may be responsible for paying back any advanced premium tax credits received during the time they were receiving benefits from Medicare. Doesn't cross back and forth, remember? Consumers who are eligible for premium-free Part A and don't enroll in Medicare are no longer eligible for those tax credits the month their initial enrollment period with Medicare ends. Consumers who are eligible for premium-free Part A should enroll in Medicare as soon as possible. And if the consumers are enrolled in premium-free Part A, they will need to return to the marketplace to end their tax credits. They'll have to pay back the full price of their premiums for the marketplace plan. So if those consumers don't enroll in the Medicare Part A during their initial enrollment period, they may have to pay late enrollment penalties when they decide to enroll. They may also face a gap in coverage if they have to wait until Medicare's annual general election period. So when we look at some of the data that comes back and forth with duly enrolled consumers, we see that the marketplace is mailing paper Medicare data matching information to the consumers who may be enrolled in both Medicare Part A and a Medicare plan. So this can add to the confusion for some of the folks that are in this situation, and may be a very valuable portion of what we need to do when we visit with people about these coverages. So if a person with disabilities also is dealing with the marketplace, they may qualify for Medicare based on a disability. They've got to be entitled to Social Security Disability Insurance, SSDI, benefits for 24 months before the Part B kicks in, with the exceptions for Lou Gehrig's. If they're getting SSDI, you get on a marketplace plan to cover during that 24-month waiting period. And they may qualify for Medicaid or a marketplace plan with premium tax credits and reduced cost sharing until that coverage begins. For those folks that are working through SHOP, Medicare is a secondary payer here. They can delay their Part B enrollment while covered by marketplace through SHOP, and they will have a special election period to sign up for Part B without penalty. It's a timing thing once they're in, and if they don't sign up during this step, then they're subject not only to that penalty, but also that general enrollment time period, which happens first quarter of the year. Prescription drug coverage and marketplace plans, including SHOP, aren't required to be credible, or at least as good as Medicare's. So the plans are required to let you know in writing each year if they are, and you might have to pay a late enrollment penalty for Part B if they enroll after the IEP and don't have creditable drug coverage. That penalty is 1% of the national average per month of the number of months that they didn't have the coverage. So to find out what prescriptions are covered through the marketplace plan, go to the insurance insurer's website to review the prescriptions. And keep in mind that changes year over year. Review the summary of benefits and coverage. Call the insurer directly to find out what's covered, and review any of the coverages the plans may have mailed to you, either by snail mail or by email. Dental coverage can be a challenge for many individuals because sometimes we tend to put off coverage or put off the care until it's absolutely necessary. And for those that are covered by some marketplace plans, people with Medicare generally can't can't join a standalone federally facilitated market dental plan on a standalone basis. If the state runs its own marketplace, we need to check with each state to see if it's permitted. Dental coverage, by and large, is not covered by original Medicare, and it may be covered by some Medicare Advantage plans to one degree or another. Hence the need for those ancillary programs with the dental, vision, hearing benefits. And you look at the Medicare savings programs, these are the programs that can help pay Medicare costs for people with limited income and resources. You have both an income and an assets test that comes into play, and these are often higher income and assets limits than full Medicaid or layers of these programs, QMB, SWIMBs, QIs, and QDWIs. We have full information on those programs in additional webinars, and that link to those coverages will be coming to you as well, with an updated version coming very shortly for you as well on our schedule. The extra help bit, this is for folks that can qualify based on income and assets. This can go up to 150% of federal poverty level, and this helps with drug coverage, not medical coverage, and there are different ways that they can enroll in this as well. We do have the information specifically for low-income subsidy, extra help, and this, along with a link for the MSP programs, will come to you as part of the follow-up to today's presentation as well. There isn't enough emphasis we can place on timelines than we can do. I mean, we just have to beat it to death. If an individual such as Jim has had Part A for 2 years, he didn't enroll for Part B during his IEP, he signed up for Part B in January 2017 with that coverage coming into play on July 1st. Could he have enrolled in a marketplace plan while he was waiting for his Part B? No. You get that MEC coverage consideration with the Medicare Part A, and he couldn't have it because, remember, you can't go back and forth, and it's illegal for anyone to sell a marketplace plan if you have Medicare in play. Way to connect with the marketplace, of course, get those updates from healthcare.gov, and they're available in Spanish as well. The government's really good about maintaining their social media sites, so you have information available through Twitter, Facebook, and YouTube. My pronunciation of Twitter still works as long as you go to the right site. You've got a health insurance blog maintained by healthcare.gov, and you can also get the information you need on those training programs through this link. It's important for us to realize that we're kind of talking to two audiences today. One may be for folks that are going, come on, John, I've been active in the under 65 market for nearly 10 years. I know all this stuff, but there's a portion of the folks that have chosen not to engage in that arena, and this can be helpful for them. Some additional resources that are available, once again, through all the different pieces that can come into play for you for interaction between the two programs. That can be very helpful for you. You access it through these links. They're live links. You can also have additional information if you get into the nitty-gritty when you're dealing with specific questions in an arena on one side or another that you may not be as familiar with. This is that link to that training program from the government. Once again, please make use of it as well, and you'll see resource as much as what we are showing here to you now. I enjoy the communications that come to us through these training program outreach. It's very helpful for us to maintain our knowledge on these different programs because, yep, they change all the time, and yep, there are special circumstances like what we're going through now, and having the information straight from the horse's mouth can be very valuable to us. We kick out a lot of this information through our Premier Insider newsletter for agents that have contracted with us. We maintain it that way because we have permission to reach out to those folks. So you can go direct for some of this as well. We try to integrate in not only this information, but also different pieces of information from Medicare.gov and some of the nonprofits that are very helpful at this time as well. How do you get information on the different programs that are out there for folks that need the Medicare coverage now? Well, there's the Medicare Plan Finder. It went through some changes this past year that made it not quite as useful for us as agents to maintain information year over year without acting as the individual, but it can really give you the information you need on all the health programs that are available for your prospects and clients by zip code, which is really helpful to you. It doesn't necessarily give you all the information about those programs. You do have to go to their sites to pull in providers, and drug information is still a viable portion of this comparison tool. We also, of course, have different tools that can help you through Premier that can help not only get the folks that information, but also give us the opportunity to sell those programs. When you use Medicare.gov's Plan Finder, it will drive them in many circumstances to the carrier's website, and you don't necessarily get credit for that sale. The programs we work with obviously tie that information to you as an agent and helps you across the board, not only in the base coverages, but cross-selling additional information to further protect your prospects and clients and enhance revenue streams for you and your agency. The tools we use is provided by CSG, and it gives us information across the board that not only helps us stay compliant by collecting the electronic scope of appointment and storing it for the required 10 years, but also gives us information on Medicare supplements in the area, which gives us an idea as to not only being able to offer that supplement review, but also gives us as agents ideas as to whom we need to contract with. Information on Medicare Advantage and other fill-in programs such as the hospital indemnity and dental programs that are valuable in each type of base coverage, the EAP function. The only thing that you have in here that you need to be really concerned with if you're discussing Medicare Advantage programs, you can discuss hospital indemnity and dental programs during that same conversation. Not so with final expense. That require that still that 48-hour cooling off period. Those requirements are not part of the oversight for Med Subs. There's a different piece on cross-selling that will come as part of the follow-up today's presentation as well. Our Medicare Center program, however, will also help you collect that scope of appointment and do plan comparisons side by side with companies with whom you're contracted. It gives the prospecting client an opportunity to shop with the information that you send them so they become familiar with their options. We're finding through different surveys that the younger generation or the people that are very much technically proficient like to do that themselves, and it gives them an opportunity to self-enroll into one of the options you present them, and you still get credit for it, even if you weren't actively a part of that enrollment. It helps you with folks that don't want to meet face-to-face, the procrastinators, the things that come about with Mother Nature, and I guess we've considered COVID-19 Mother Nature. It helps with the spread of folks across the market you serve, so those mileage challenges may not just be mileage challenges. If you work, say, in Houston and you're going from one part of the world to another part, it's traffic and time. So that helps you control that windshield time as well. Gives you a whole bunch of ways to take care of the population that are really, really mindful of the urgent situation they find themselves in. Doing things electronically can obviously speed the process. It allows them to be comfortable with that process as well, because they're looking at multiple plans side by side. They're including the options that are available to them in the Medicare Advantage and PDP space. And these electronic presentations are stored for you so you can do year-over-year reviews and watch the persistency of your book of business through this system as well. Gives you 3 options to help them enroll into the programs that are available to them through you. Some of the additional things we can help you with is obviously making certain that we help you protect your business through a discounted E&O program for qualified agents. That means, well, you got a contract with us. But it helps you with the coverage regardless of who your other lines of business are contracted through. And that's important to note, because there are organizations out there that can help you with adding one particular program to their blanket E&O, and you got to worry about the rest of them. This takes care of all those programs available to you, and we help you keep your insurance license in play as well through discounted CE bundles through WebCE. This gives you an opportunity to pick up non-cancelable DI coverage on a modified guarantee issue basis, discounted rates for your own benefit package. And much as where today's presentation is being recorded, we do this on a regular basis, and those recordings are available to you through our Premier website, premiersmi.com, or through our YouTube channel. And we now have a Facebook chat forum for our agents as well, where much of this information is being made available there too. One of the things we want to make certain that you are aware of is the full compensation that you receive for the sale of different products. Many carriers will offer trips and incentives. The trips and incentives, well, trips now obviously are being curtailed because of the health situation worldwide, but those incentives that are qualifying you for those trips and incentives include everything but MA and PDP programs, because that's standardized compensation dictated by the government. But they also help you qualify for the Premier Producers Convention, which this month was to be a cruise from Miami to the Bahamas. Needless to say, that was canceled. Information will be available to you shortly on next year's. We have ways of getting in front of people as well. This can be a very important portion for you to make certain that you maintain your activity and your income, most importantly, during this time period of social distancing. Different lead sources that are available to you, custom lists, doing some things to get into centers of influence now, which is important because they need your help too, even socially distanced. But the joys of electronic support can be there, where you can take a live situation into virtual reality and still make it work. Carriers can help with prospects as well. We have a number of co-op programs and open and available through different carriers depending upon your location and your situation. We do have Facebook Internet lead programs, very active in the final expense space. It's being rolled out in the Medicare world, and we still help with the tried and true direct mail support based on production. We deeply discount the cost of those lead programs in the Medicare space, a separate program available for those active in final expense, so you can double dip in a manner of speaking. All said and done, we want to work with you in the different situations that you find yourself in, such as dealing with folks who have lost their jobs and their coverages, and how we can help you in those circumstances. We want your business, and we're asking for it. It all depends on if this is an important part of your overall marketing plan. If so, we've been socially isolated for many of us for a month now. And as John Wayne says in the the great classic, the Cowboys were burning daylight. We need to make certain this is part of the marketing program you have, and that we're working forward to actively utilize it as part of our overall marketing plan. You can reach any of us at Premier at 1-800-365-8208 or through our website at premiersmi.com. This information will come to you as part of an email situation for individuals who have expressed interest in today's program. So obviously you can just kick back a question to that, and we'll make certain the appropriate marketer takes care of you. Let's check for some questions. One of them says, so are you saying there is a change in SEP due to COVID-19 or not? It depends upon if it's under 65 and over 65, but yes, there is a SEP due to COVID-19 in the Medicare space. Known SEP interested in any new SEPs that are in effect, that information will come as well. The question is, does Premier have any under 65 carriers? We have programs that are offered to folks under the age of 65. They're ancillary programs. We have a system set up to handle requests for under 65 ACA carriers. They are not directly through Premier itself, but with one of our platform partners who helps us in that situation. So all that said and done, watch for the communication we'll be sending. Give us a call with any immediate questions at the toll-free number, 800-365-8208. Until we are able to converse with you, we wish you a good selling period, regardless, good selling, and God bless you, stay safe. Thanks so much, and we'll talk to you all soon.